The federal Medicare program is like an alphabet soup of things to know. We can talk about Part A, B, C, of course D, and then we can also talk about plans A, N, G, and F. Let's not forget DVH plans. It can literally be endless. We aren't going to get to all of those today, but we are going to focus on one of the most important plans that you have to have when you enroll in Medicare, and that is a Part D prescription drug plan. Hello everyone, my name is Courtney Dale and I'm the President and CEO of Sunflower Insurance Solutions. We are an independent brokerage that helps people and consumers on Medicare look at the different plans associated with Medicare that fill in those gaps. We also help with a couple of ancillary plans such as dental, vision, and hearing, cancer, heart attack and stroke, hospital indemnity, and we do a little bit of investment plans for people, an insurance product called an annuity. Today we are talking about Medicare Part D plans. We're going to talk about how they work, how you can enroll, and all the different ones that are available to you. As we said in the beginning, Medicare provides prescription drug coverage. These plans are purchased through an independent insurance company, but they are monitored and regulated by the Center for Medicaid and Medicare Services, also known as CMS. None of these plans are one size fits all, but today we're going to talk about how to choose the right plan for you. You can get a Part D plan in one of two ways: by purchasing it as a standalone prescription drug plan, or your drug coverage would be included in a Medicare Advantage plan if you live in an area where the Part C plans are available. Again, they are not one size fits all, but they all somewhat work the same. Each prescription drug plan has different tiers within the formulary. What that means is your drugs are going to fall into one of the 5 tiers. If it's a lower tier 1, that's the cheapest. When we go up into tier 5, those are more expensive drugs. So there is a range on what you will pay for your co-pays, but that's the simplest way to describe how your specific drugs fall into those individual tiers built into each prescription drug plan. I want to address a concern of everyone that is new to Medicare or even has been on Medicare for a while. This topic comes up in every conversation with every consumer, and that is the donut hole. It applies to the prescription drug costs accumulating throughout the year. So what that means is starting in January 1 for everyone, the donut hole starts over. It's an accumulation of retail cost of the drug, not what you're paying for the drug, but the total retail cost of the drug. Once it accumulates to a certain amount, the first tier is around $4,600. Again, that is retail costs of the drug. You fall into the donut hole, also known as a coverage gap. What that means is while you are in that gap, you will pay more for your drugs. To get out of that gap, the costs keep accumulating and you go to the next level, which is around $6,700. Again, retail cost of the drug, not your costs. And then you only pay a small percentage and you are now in the catastrophic coverage. So it does get better. It has to get worse before it gets better. But the way to stay out of that is to strategically have your plan reviewed every year to make sure that we can keep you out of that donut hole for as long as possible. All right, now that we've explained a little bit about how the Part D prescription plans work, now we need to talk about enrollment. There is a myth out there, and everyone thinks that just because you are turning 65, you have to enroll in all of your Medicare plans. That is not true. If you have credible coverage from an employer or a spouse's employer group plan or anything that the government deems credible coverage, you can continue on that plan past the age of 65. When you do decide to enroll in Medicare, the one thing you have to do is enroll in a Part D prescription drug plan. The reason for that is if you don't, they will assess a late enrollment penalty when you do decide that you need prescription drug coverage, and the penalty can be significant. So as soon as you start your Medicare A, B, Part G, Plan G, Part C, whatever it is you're starting, you need to add on that prescription drug coverage to avoid the late enrollment penalty. How do I choose a prescription drug plan? You are going to want to compare all of them. The easiest way to do that is to work with somebody who specializes in Medicare, such as Sunflower Insurance Solutions, or an agency like us that can plug in all of your prescriptions, dosage, and compare all of that with what pharmacy you choose, your in and out of network area, and all of the variables that can affect the Part D cost. You can also do that on your own by going to medicare.gov. The last piece of advice we have is to have your drug plan reviewed every year during the annual election period. October 15th through December 7th is the only time of year that you can make changes to the upcoming plans for the following year. The new plans will start on January 1, but the window to change those is the annual election period, October 15th through December 7th. It's very important to have all of those reviewed. There's a significant cost savings associated with most of the plans. Sometimes you don't need to change the plan, but most of the time people can save a significant amount of money by just having a review done by a Medicare professional. Do you want to know the best way to choose a prescription drug plan? Work with an agency like ours. You can have a free consultation done during annual election period with us anytime during October 15th through December 7th. Give our office a call to set up your time frame, 785-301-2716, or give us an email at info@sunflowersenior.com.